robotic-assisted surgery allows us to do a few things. It starts with the preoperative planning. We start by getting a CT scan of the patient's joint, and that better helps us make a plan three-dimensionally. And then in the OR, the robot allows us to incorporate some more unique features about the patient's anatomy to help precisely position those components. And then finally, through a haptic arm, the robot helps us prepare the bone down to the 0.5 millimeter in a very precise fashion. And it's with this increased precision that we hope we achieve better early and late outcomes.
With the MAKO technology, the concept really revolves around more precise surgical procedure. So in surgery with traditional instrumentation, we're asked to make bony cuts to get the limb alignment as close to perfect as possible. We have to make some accommodations for human error when it comes to making those cuts, so we shoot for the middle of the road, and people do very well with that. With the robot, we can dial in within 0.5 degree of what we'd like to do in terms of getting the cuts as close to perfect as possible and remove the human error part out of it. So as a surgeon, we still make all the decisions about how we would like the knee to feel at the end of surgery, but the robot helps us accomplish that more accurately.
A lot of patients ask me if the robot is doing the surgery for me, and that's not the case. What I prep my patients for when I discuss with them is there's a couple things that the robot technology does not do. It does not do the surgery for me. I'm there, I'm scrubbed in, I'm the one making the adjustments and doing the surgery. It does add an extra incision, which patients should be aware about, and it doesn't necessarily speed up the procedure itself, but I do think that it makes it more accurate. In the end goal of these long-term surgeries, that accuracy is paramount.
I've heard a couple concerns about robotic-assisted surgery, one of which is patients want to know if the robot's performing the surgery. Luckily, surgeons still have a job. We are in complete control of the procedure. We really just use the robot's haptic arm to help us be more precise. In some ways, that can help us protect the patient and their adjacent soft tissues.
It's been great for Lovelace. I think its ability to give us a slight advantage with this tool. It helps us with our precision during surgery and kind of eliminates outliers, which I think has been eventually proved to be great in terms of patient outcomes in general.
The surgery is a very good surgery with traditional instrumentation, and it's a very good surgery with the robot. The robot just adds one more layer of precision to the surgery. If you'd like to make an appointment with me, with Dr. Wojcik or Dr. Gilligan, please call 505-727-2727 or go to lovelace.com and you can arrange for a meeting via the internet.